Good morning. It's my pleasure to welcome you to the White House. My name is Jeffrey Crawley, and I'm the Senior Advisor on Disability Policy within the Domestic Policy Council, or as we call it, DPC. And Kareem Dale and I work together covering the disability policy agenda here at the White House with our other DPC and other White House colleagues. So I do want to acknowledge Kareem for his work in pulling this event together, but I also want to acknowledge our many colleagues at HHS who did this. And I'll just name one, and that's Henry Claypool, who's the Director of Disability there, and obviously is a great friend and colleague pulling this event together, but doing the hard work day after day. So thank you, Henry. So this event is just one of several activities that we're doing as we lead up to the 20th anniversary of the Americans with Disabilities Act. And obviously, this is a huge milestone for the disability community. We thought this event was important because, the President's shown a strong commitment to civil rights enforcement and the ADA, as well as, that working with Secretary Sebelius and so many others, he achieved a pretty significant milestone through the Affordable Care Act. And so we thought today's event was really particularly important to just talk about how these fit together, because they really are integrally related. So with that, I'm going to stop and just say I'm really happy that you could join us here today. Now, it's my pleasure to introduce Melody Barnes, who's the Director of the Domestic Policy Council. And I have to say that she is the whole package for the disability community here in the White House, because she's always there to support me and Kareem. She has her own extensive background working on civil rights issues, but she also seems to just really get disability. So it's not just like, this is another group. I think she always just really understands some of the personal struggles people face, and I think she really brings that to everything she does. So with that, pleasure to introduce you, Melody. Thank you.
Well, thank you so much, Jeff. I mean, that really means a lot. I appreciate that. And good morning to all of you. It is wonderful to be here with you today, and I am honored to represent the White House and to represent President Obama, who so strongly believes in the civil rights enforcement around the Americans with Disabilities Act and the celebration of this anniversary. As Jeff said, this is such an important milestone for all of us. And one of the reasons we believe that is because the ADA was really a Bill of Rights in and of itself, and it's a formal acknowledgement that those who are living with disabilities are Americans first and deserve to enjoy all of the rights and responsibilities that go along with being an American. And that's what passage of the ADA 20 years ago, I think, meant for all of us as a country. So it is our pleasure to celebrate its anniversary. As many of you know, and I think going to some of what Jeff said, I spent many years working for Senator Kennedy in the Senate Judiciary Committee. I was with him for about 8 years. And one of the things that I learned was not just through the work that I did on a day-to-day basis, but actually watching him as he did his work. And as you know, he was such a staunch advocate for this legislation. And it was not just for the legislation in and of itself, but everything that came out of it. And he didn't segregate disabilities issues. He thought about the issues of disability in a holistic way. So as we were working on education issues, or as he was thinking about sports in the United States, or the arts, as he thought about our returning veterans, in every case, and so many other issues, he would think about the disability community and what it would mean, what the impact of the pieces of legislation we were trying to pass or the policies we were advocating for, what that would mean for those living with disabilities and the families, the people who love them, and would try to move us forward, move the ball forward each and every day. So I also believe that as we celebrate the anniversary, his spirit is here with us in celebration. Of course, as many of you know, we didn't just start the celebration today. Why limit? It's kind of like the way I feel about my birthday. Why celebrate on one day when you can really stretch it out? So we've been working on this, and we've been commemorating the 20th anniversary over a longer period of time. This started out when White House Senior Advisor Valerie Jarrett spoke at the Kennedy Center. I don't know how many of you may have been there, but spoke at the Kennedy Center and delivered remarks at the VSA International Festival. And also, some of you may know, next Monday, we're going to be working in partnership with the Federal Communications Commission and the Department of Commerce to host an event that celebrates the anniversary of the ADA and also highlights the way that technologies have further worked and how they've been so important in further empowering those who are living with disabilities. Now, of course, there's a reason why we celebrate, and my guess is that everyone in this room knows someone who's living with a disability or is living with a disability him or herself. And that touches, for us in the White House, the boss, the president, who speaks very movingly of his father-in-law, Fraser Robinson, who was a very active and athletic person who worked in Chicago at a water treatment plant and was diagnosed when he was in his 30s with multiple sclerosis. And there are so many barriers and so many hurdles that he had to confront as he worked to try and provide for his family. And at the same time, he didn't have the benefit of the ADA. He didn't have the benefit of the law and the good policies that we've been able to move forward in the years since its passage. But because of your hard work and your determination, there are so many people who now do have those benefits, and those benefits have improved their lives and the lives of their families. Last year, on the anniversary of the landmark Supreme Court decision in the case Olmstead versus LC, President Obama announced the Year of Community Living. And that's a new effort to assist Americans with disabilities. And at that time, President Obama said, quote, "Olmstead was a critical civil rights decision that affirmed a fundamental right for Americans with disabilities, the right to live independently." And this administration has shown, and we will continue to show, our commitment to addressing isolation and discrimination affecting people with disabilities. The President has directed Health and Human Services Secretary Kathleen Sebelius, who you'll hear from in just a moment, and Housing and Urban Development Secretary Sean Donovan to work together to identify ways to improve access to affordable housing, community supports, and independent living arrangements. And their agencies have launched several new initiatives, including one increasing Section 8 housing vouchers and also enhancing interagency coordination. HHS has also conducted listening sessions around the country to hear the voices and the stories of all Americans. And I use the word hear, but as I was thinking about that, so much of it is listening, and listening in a way that impacts our policy and the way we think about our work, so that when we are all sitting at the table together, we're much smarter about that, and we can bring those stories and those lessons to the work that we're doing here in Washington. As part of the Year of Community Living, Secretary Sebelius also created the Community Living Initiative to coordinate the efforts of federal agencies and underscore the importance of the ADA and the Olmstead decision. The administration has also been hard at work implementing the Money Follows the Person Rebalancing Demonstration Program, or MFP, which awards funding to states to increase their use of home and community-based services for eligible individuals who choose to transition from an institutional setting. MFP allows Medicaid funds to be used for necessary long-term services to achieve continuity of service in transitioning from an institutional to a community setting, and to ensure that procedures are in place for ongoing quality improvement in the implementation of Medicaid home and community-based services. HUD has also encouraged housing authorities across the country to support the MFP initiative through the establishment of preferences for institutionalized individuals who are in need of affordable community-based housing. And just last month, HHS awarded a $3.2 million contract to establish a housing capacity building initiative for community living. Other federal departments and agencies have been doing their part as well. This isn't just something we see as limited to HHS. Again, it's the idea that this has to be holistic. We have to address the whole person and the many aspects of their lives. So the Justice Department Civil Rights Division has taken steps to ensure that we remain true to Olmstead's promise. It has filed lawsuits in Arkansas and Georgia, intervened in a case in New York, and then filed 7 amicus briefs in different states in support of Olmstead. In these cases, the government is fighting to ensure that people with physical, psychiatric, and developmental disabilities can leave inappropriate institutional living arrangements and receive services in supported housing and other community settings. Also at the Department of Justice, DOJ is working with the Department of Education, and they've recently announced the publication of a joint Dear Colleague letter reaffirming their commitment to ensuring students with disability have equal access to emerging technologies in institutions of higher education. So as we mark the 20th anniversary of the ADA, We all believe that we have to continue doing what we've been doing, but we have to renew our commitment to uphold the civil rights of those living with disabilities and fully include all of our people in the life of our nation. So that's why the President was so proud to add America to the list of 140 countries that signed onto the United Nations Convention on the Rights of Persons with Disabilities. And Kareem was such a leader and working inside the White House to get that done. And the convention was the first new human rights treaty of the 21st century. And that's why the President lifted the ban on stem cell research, one of the first things that he did after being inaugurated, to allow further scientific discoveries that could one day spare others from suffering. That's why he provided more than $12 billion in funding in the Recovery Act for Individuals with Disabilities in Education Act, and that's why he signed into law the Christopher and Dana Reeves Paralysis Act. I know that so many of you, there's so many unsung heroes, and as I mentioned, Senator Kennedy, who can't be with us today, but who join with us in celebrating this anniversary, who are proud of the work that we've done and want us to continue to work together to make sure that we can fulfill the promise of the ADA and the promise of the policies that have been built around it, because we know that we are making progress, but that we can do so much more. So thank you for being with us. I hope you enjoy the rest of our program. I know we're going to hear from so many interesting people here today, but at this point, I want to turn the program over to Secretary Kathleen Sebelius, who is such a tremendous leader on this issue, as she was in her home state of Kansas and is here now as the Secretary of Health and Human Services. Secretary Sebelius.
Thank you. Well, thank you, Melody, not only for that kind introduction, but certainly for your leadership in the Domestic Policy Council. And in addition to Henry being here, we have several other of our great HHS leaders with us, because we see this as an initiative that really requires leadership from all facets of the Department of Health and Human Services. You know, the passage of the Americans with Disabilities Act 20 years ago wasn't just a historic victory for equal rights and a milestone of American history. It was also, as those of you who fought for it remember, a great legislative achievement. It took the whole disability community banding together, legislators from both parties showing unusual courage and years of hard work. This didn't just happen overnight. And the final bill actually was more comprehensive than anybody had dreamed it could be. It broke down barriers in the workplace and in housing and schools and shopping malls and telecommunications and public transportation. But there was one key form of discrimination allowed to stand, and that was in the health insurance market. The discussion early on in the debate was, should we tackle that too? Can we have that as part of this act? And it was seen as something that was impossible to include in the bill. So it wasn't just an oversight. There were lots of debates and arguments about could you pass the ADA 20 years ago with the inclusion of a dramatic change in health insurance, and the decision was no. So unfortunately, that piece was removed from the bill along the way. So in March, when the President signed into law the Affordable Care Act, the final piece of the ADA was really put in place. And I think it's unfortunate that it took another 2 decades, but it's an enormous step forward that we now stand at the brink of a whole new day. After years of debate, finally fulfilling the full dream of the ADA is so important. And I think the Affordable Care Act really took a lot of the values of the ADA, promoting fairness, empowering consumers, giving people new choices, and applied it to an area where, if you think about Americans living with disabilities, they need it the most, which is really control over their own health care. Every American is going to be a beneficiary of the health reforms, but because over the last few decades, the Americans with disabilities have been more likely to be mistreated by insurance companies or fall into health insurance coverage gaps or lose their coverage when they need it most. There's no question that the Affordable Care Act will indeed help those with disabilities more significantly. It does more to give Americans control over their lives, and particularly those with disabilities control over their lives, than any legislation since the ADA was passed. Some basic fairness is going to be restored to the insurance system. For years, companies have been able to pick and choose who got coverage, what was covered, and who could be locked out or priced out of the market. And typically, anyone with an illness or sickness had two choices. One was a plan that often was priced way out of people's reach, and the other might be a plan that didn't cover the treatments they needed in the first place. Neither choice very satisfactory. So with the Affordable Care Act starting this year, those changes begin to happen. Plans that will be offered after the fall of this year will have to start right away to cover children with disabilities. Children with pre-existing conditions can no longer be excluded from their parents' plan, and that's a big step forward that will apply to adults by 2014 when we create the new marketplace. But in the meantime, there's a sort of bridge strategy, an additional pre-existing condition pool that will be available in every state in the country to offer one more choice to those adults who have pre-existing conditions. We have a brand new website, which is, again, a new consumer tool that is pretty cool, I must admit. But also, I'm a believer that transparency does provide competition in and of itself. It's a good market strategy. So for the first time ever, with healthcare.gov, individuals can go on the website, put in a little personal information, where you live, what age you are, what your health status is, and instantly available are all the public and private plans to choose from and what the eligibility criteria is and how to get enrolled. A lot of people really don't know what their options are, don't know that they may be eligible for programs, and I think this is an enormous step forward. By the fall of this year, that website will also include cost information, so you actually could do shopping on at your kitchen table or with a family member before you get pressured by an insurance agent to buy something. You can really figure out what the strategies are. We thought it was important when we put together scenarios on that website to do some profiles, and one of the profiles is an individual with disabilities that can walk through all of the choices and options, because we thought it was critical wherever people lived in the country that they had a way to get a profile of what was indeed available to them, both in terms of the public program and the private market. So it's a powerful new tool. Transparency, some information to give Americans across the country, but particularly Americans with disabilities, some key information about taking back some control over their own health care choices. This year, also, the new Patients' Bill of Rights goes into effect starting this fall. The President felt it was very important to capture a series of initiatives as we built toward the new market that made it available to individuals the kind of health insurance that they rely on and need. So starting this year, insurance companies will no longer be able to put a lifetime limit on the benefits provided, can no longer conduct business with using the somewhat despicable policy of rescissions, where a technical error or a billing error might bounce somebody out of a program. Typically, after they begin using their health benefits, the company goes back and tries to discover some way to discontinue the policy. Those practices will stop once and for all in this country and never be allowed to happen again. And for those of you who have ever fought with an insurance company, something that I made my business to do for 8 years as insurance commissioner, it establishes a basic principle. If you do the right thing and pay your bill and purchase a policy in good faith, we expect the insurance companies to do right by you. That's why you buy insurance in the first place, is to use it when you need it, and the rules need to have some fairness and equity about them. The protection will apply to nearly all plans this fall, but there are still gaps in the health insurance system that needed to be addressed separately. So you'll hear in a few minutes from one of our guests today, but the situation that a number of young adults find themselves in this country, where graduating from high school or from college, or reaching a birthday, often 21 or 22, depending on what state you're living in, was good news on one hand. On the other hand, it meant that folks lost their health insurance. And in this job market, often did not have a job that came with health insurance if they had a job at all. If you are a young adult with a pre-existing condition or a disability, that condition, that situation of being locked out or priced out of the market is extremely difficult and potentially very, very dangerous. So the benefit of having young adults be able to stay on their parents' plan until age 26 couldn't have come at a better time, and again will help all young Americans, a third of whom are uninsured right now, but particularly will help those younger adults who have a pre-existing condition. Medicare beneficiaries begin to get a break starting this year on the prescription drug purchases. And again, there was a huge gap in the Medicare bill when it was originally designed, which is that it didn't include a drug benefit. So you had sort of guaranteed insurance for seniors, but without the prescription assistance they needed. Unfortunately, when Congress passed the drug benefit, added it to Medicare, it had a design flaw, a serious design flaw, which was that after you used up to about $2,000 in your drug benefits, you then got to pay 100% of the additional prescriptions on your own, the so-called donut hole, where you didn't have any further help. And it applied, again, the people who found themselves in that condition, and there are 8 million seniors in America who hit the donut hole every year, are those seniors who use the most prescription drugs. So just the people who need the benefit the most are the ones who actually suffered from this situation. So over time, that so-called donut hole, the gap in coverage, is closed altogether. But starting this year, seniors get a $250 rebate check. Next year, they will see a 50% decrease in the cost of those drugs in the donut hole. Medicaid will eventually be expanded when we have the new marketplace, which allows a number of Americans with disabilities who may not meet the standards in the Social Security Act to get a health plan that provides for a range of benefits. Later today, I'm going to join the First Lady in announcing that we are putting into place the regulation that will help to eliminate the copays for preventive service like cancer screenings and access issues, because what we know is that having a financial barrier for preventive care is often a barrier that's too high for people, and consequently we have way too many folks who end up in a life-threatening situation or with a chronic disease that could have prevented it in the first place. The Food and Drug Administration is working with the U.S. Access Board on new accessibility standards for preventive services. There's no reason at all that a mom has to go without a mammogram just because none of the machines in her area is suitable for a woman in a wheelchair. We need to make sure that accessibility is not an additional barrier. So the reforms that go into place right away are going to knock down barriers that have prevented Americans with disability from getting the health care they need. They shift the balance of power from insurance companies to consumers, and they give all Americans better choices. There are other areas, though, of the new law beyond just the health insurance market, and that change is pretty dramatic, that are important for Americans with disability, although they have gotten a lot less attention. The expansion of long-term care services and supports. Over the last few decades, advances in medicine have allowed Americans to live longer and more independently with conditions that 20, 30 years ago would have been fatal or so debilitating that you had very few choices. And often the healthcare system hasn't kept up with those changes. So the Affordable Care Act accelerates the progress that we've made to give Americans better long-term care choices. Expanding the Money Follows the Person rebalancing demonstration program. And again, we have a special guest here who's going to talk a little bit about what that means on an individual basis. But over the last few years, that program has allowed more than 8,000 people in 30 states to transition from institutional settings to their home communities, where they have greater satisfaction and actually lower costs of care. And under the new law, we're extending that program through 2016 with a $2.25 billion in new funding that will be critical to, again, allow individuals to make choices on their own. Beginning next fall, the Affordable Care Act creates a community first choice option, which gives states an enhanced match so they and other community-based services can be offered alongside nursing home and institutional services. With me today is Kathy Greenlee, who is our Assistant Secretary on Aging, who led this effort as the Secretary on Aging in Kansas and is in a perfect place to help this initiative expand. Works very collaboratively with Henry Claypool, and we think this is a huge option for people that will expand a lot of opportunity. The bias in Medicaid toward moving people into institutions is really left over from a time where it was harder for people to live independently, and policies which often failed to take into account people's preferences or choices. The money was just placed in one spot. So the Affordable Care Act, we're committed to providing new incentives that give states opportunities to continue rebalancing and to give Americans who want choices, more choices in long-term care services. To that end, the new law also has a new self-funded voluntary insurance program for long-term care and supports, a policy that was championed for many years by Senator Kennedy, and I know Melody worked on that, the Class Act, debated often in the Senate but never passed, and it has now become the law of the land thanks to the signing of the thanks to the Affordable Care Act. So too long, folks have been shut out of the private long-term insurance market and had very few choices, and this will give an opportunity to build a fund and use that for a whole variety of services, and we really look forward to standing up that program. It's one of the main initiatives that is underway, and getting input and feedback along the way on services and supports that will be essential. So the law is structured in a way that the reforms go into place over a period of years. But across the country, Americans with disabilities are already seeing tangible benefits. We're so pleased to have two special people here with us today. Teresa Hammond's son, Quentin, suffered a traumatic brain injury when he was 4 weeks old after he spent his first 6 years in a children's nursing home. Teresa wanted her son to live at home, surrounded by family and friends who loved him. So she worked through the Money Follows a Person program, which provided Quentin with an accessible home and ramp, with bedding and clothes, with furniture and more. Everything he needed to get the same high level of care that he got in his nursing home. Because of the program last December, Quentin was able to come home. And now you're going to hear from Teresa about how this change has helped Quentin thrive. Before I bring her up, I just want to mention that these are exactly the kinds of improvement choices that we're trying to give all Americans with the Affordable Care Act. When the ADA passed, some people asked questions like, why would employers need to put an elevator in if they had 6 or 7 floors in the office building? After all, couldn't you just put everybody with a disability on the first floor, avoiding the cost of the elevator? And the answer really is pretty simple. In this country, we believe that no one should be limited to one floor, should have an access to all the floors available to them, to all the choices available to them. And when there are other options available, those options need to be available to all Americans. Everyone should have the freedom to make the best choice for themselves and their family, and the Affordable Care Act moves us in that direction. You're also going to hear in a few minutes from Tina Westra from Grand Rapids, Michigan. Tina is 22, and like a lot of young Americans, including my 2 sons when they graduated from school, her first thought after graduation was, how is she possibly going to get health insurance? And for Tina, that carries an additional burden because Tina lives with epilepsy. So she found a job in Virginia, but couldn't find any health insurance except a very limited policy. And again, thanks to the Affordable Care Act and her family plan, she now can take the job that she wanted and live independently, knowing that her health situation is well taken care of. So the promise of the Affordable Care Act is fulfilling the promise of the Americans with Disability Act. It's an integral part of an unfulfilled gap in the plan, and one that 20 years later we are thrilled to be able to put into place. You all worked on the passage of the original bill, and your work wasn't finished. We then appreciated your help and support in passing the Affordable Care Act, but that work isn't finished. We will continue to put the pieces in place that make these choices available to everyone. So I would like to ask Teresa to come up and share your story about Quentin, please. And I'm going to stay right here with you. Let me hold this. This is Quentin.
Hello, my name is Teresa Hammonds. I'm here today to talk about my son Quentin. I believe it takes one person to stand up for a child and advocate for their life, advocate that their life should be something more than what it is. Before Quentin found his one person, my son lived at a nursing home. He lived there as a result of a severe traumatic brain injury as an infant that left him with severe medical needs. I did not know how I could meet his needs on my own, and I was discouraged from trying to. I was always told that there was no resources for me and my family. I lived 2 hours away from the nursing home, and I missed my son every single day. I moved to live closer to him and visit as much as I could, but even that wasn't enough. While my son was at the nursing home, I was told he was blind, vegetative, and that any response he made was due to a seizure. He did not have a chance to learn, to feel loved, or develop as other children do when living in a nursing home. For nearly 6 years, I was made to feel that I didn't even know my own son. Someone always knew him better than me. I was told he should never have been resuscitated, that he did not understand anything, that he couldn't even enjoy the outdoors. I was sick of being told that. I kept telling the nursing home and caseworker that I wanted to bring my son home, even though they didn't believe it would be possible. Eventually, I was referred to brain injury surgeons and began working with Brooke and Nessa. I didn't know at that time, but Brooke would become Quentin's one person, the person who would stand up for him, and we would work together to get him the life he deserves. Brooke helped us access the technology assistance waiver and the Money Follows the Person program. and to coordinate all Quinton's community-based needs. It only took about 4 months of planning after waiting for 6 years. Quinton was able to come home to live with me and his brother, and we are now a family. Quinton has been living at home for over 6 months with no medical complications. This is a huge accomplishment for my little boy, who was said to be too medically fragile to leave the institution. What has happened over these past 6 months is nothing short of a miracle. As a result of receiving homebound education, his eyesight was checked, and it turns out he is not blind. He sees color, light, and shapes, and he's only diagnosed as being nearsighted. We had an assistance technology evaluation that demonstrated his clear response to stimuli, and his ability to physically respond to verbal commands. He can lift his arms, focus his gaze, move his eyes, and center his head when asked to do so. Quinton's latest trip to the pulmonologist shows that he's starting breathing more on his own, resulting in a reduction of his ventilated settings. These changes have sparked plans that Quinton will be allowed to attend school 2 days a week in the fall and be educated with his classmates. My son, who was labeled as blind, vegetative, and non-responsive, while in the institution, has shown us that he does see and he can respond personally to verbal commands. I'm overjoyed to have my son home with me. I take him for walks, we go to the stores, and we even went to see. Sorry. We even went to see 4th of July and our fireworks in our community. His little brother says that Quinton is his best friend, and Quinton has love in his life. Now I know what's best as Quinton's mom. I knew my son is not vegetative. He is responsive, and he is very much like every child living within the walls of an institution that can live in a community. Though many people worked hard to bring Quinton home, Quinton's accomplishments since coming home as a true testament to his spirit and his abilities. Quinton clearly has taken over and is showing everyone that he is capable with the right support and with family around him. Thank you for giving me the chance to share my story.
And now I'm going to turn it back over to Melody Barnes.
Well, Teresa, thank you so much for sharing that story. Clearly has moved all of us, including me, who then had to stand up and say something. I now want to turn this over to Tina Westra, who is 22. I remember being 22 once. It's a wonderful time. And Tina's going to share with us her story and how her life has been changed by the Affordable Care Act. She's from Grand Rapids, Michigan. I went to law school in Ann Arbor, Michigan. Go Blue. And Tina, if you'll come forward and please share your story with us. Thank you.
Thank you. As she mentioned, I am a recent college graduate, and I think I can speak for most college seniors when I say that the months leading up to graduation are some of the most anticipated months and also some of the most stressful months for seniors. They're filled with excitement because we're excited for graduation and the prospect of a new chapter in life, but also anxiousness because there's the reality that there's a potentially unknown future for us. And also, for some of us, it means that we actually have to become grown-ups. In my case, I felt a little bit more at ease because I had a job lined up after college, and I was going to be working out of state privately for a family. And there were many things about the job that appealed to me. So when I looked at the job description, I thought it looked good. And I liked the idea of working out of state. And on top of that, probably one of the most logical reasons for me that it looked appealing was that it offered me health insurance. And as a person with epilepsy, that has always been something at the forefront of my job search, because it is key to my health that I have access to my medication and that I am able to see my neurologist on a regular basis. I was really excited about this, and without my insurance, I recognized that the cost would be astronomical. But my excitement was very short-lived, because when I looked into the plan further, I realized that I would no longer be able to see my current neurologist. Now, it might seem like a simple task to find a neurologist. You can just choose someone out of a list. But I hope you can kind of put yourself in my shoes for a little while and see where I'm coming from. I was diagnosed with epilepsy my freshman year of high school. And throughout the 4 years of high school that I went through 2 neurologists, and both of them put me on a variety of different medications. And while I went through periods of time where I was seizure-free, I was not living my life, because the side effects of my medication were so overwhelming that I couldn't even carry out my day-to-day activities. I was sleeping I would get home from school and I would sleep from the time that I get home until dinner time. I would wake up long enough to eat dinner, and then I would go to sleep until the next morning. And I was missing days of school because my vision was so blurred I couldn't see the board. Finally, I found Dr. Tanner, and she was the 3rd neurologist I had found, or that I had tried, and she was the first person who finally understood that being seizure-free and having my epilepsy under control didn't just mean being seizure-free. It meant being able to actually live my life and the life that other people my age were living. It meant that I could go to college and that I could do the things that I wanted to. I love rock climbing, and though it doesn't exactly work well for people with epilepsy, I needed to have my seizures under control to be able to do that. And she knew that I wanted to have my driver's license. She took me as a whole person into consideration. And after being a patient of hers for 3 years, she knows not only my health history, she knows my personal history. And that's not something that you can get just by choosing someone out of a list or at random. And thankfully, I don't have to now. Just prior to moving to Virginia, which is where my job is, I found out that I would be able to continue to be covered by my mom's insurance, and which was provided me with this just amazing sense of relief, because not only would I be able to continue to see Dr. Tanner, but another piece of this is that my medication is very expensive. I need to take 2 name brand medications, and I've tried taking the generic brands, which and the name brands are very expensive. And if I were on a different insurance plan, I would be working to pay for my insurance and to pay for my medication with very little to live on. So with those things in mind, I'm so thankful to be able to be covered under my mom's insurance plan, to the point that I can still say that I can remain happy and healthy and seizure-free at this point.
I want to thank Tina for sharing her story, and I think all of us in this room can empathize. I know I like my doctors. I consider them part of my team, so the same way I do, that should have that. I think everyone should have that. So we're so happy about it. One thing I want you just to elaborate on a little bit, you said you found out that you would be able to stay on your mother's insurance. Can you tell us a little bit more about how you found that out? And you told us about your reaction, but also your mom's reaction to that.
Yeah. My mom is very protective, as I'm sure if any of you are parents, you would know that. I'm sure you're very protective of your children. And so my mom was extremely concerned about what would happen with my health needs throughout my having epilepsy. She's just been there throughout this whole thing. So her reaction was just, she was thrilled because she knows that her coverage is so much more comprehensive than anything that I would be able to get right off the bat. The plan that I would have gotten would have been, it wasn't like it was a bad plan, but it was a minimal coverage plan. And to get anything higher would have, like I said, I would have been paying for my insurance and my medication, and I would have had to probably ask my mom for assistance to pay for all of my medication still. So my mom was just thrilled, and I think for me, I found out because her employer sent out a newsletter, and they said it said all dependents who are currently enrolled can remain enrolled till age 26. And then she forwarded that on to me and called me, and she said, "Tina, I'm so excited. This means you don't have to pay for this, and you don't have to pay for, you don't have to pay that huge amount, and it's just not this burden." And it really was. It was a burden to have to think about that. So I can't stress that enough, that it just gives me a sense of relief to know that that's a piece that, at least at this point, I don't have to worry about. And so that was how we found out. We kind of found out through this newsletter, and yeah.
That's wonderful. And also want to thank Secretary Sebelius, who did so much reaching out to the community and saying, please, let's move forward with this. Let's move aggressively to try and cover young people who are able to be on their parents' insurance, and make sure that happened as quickly as it possibly could. So thank you, Tina. And I want to turn this over now to Kareem Dale. Thank you.
As I was sitting there, I was just thinking the one thing that just kept going through my mind is that this is why we do what we do. This is why you all fought for the passage of the ADA 20 years ago, for the passage of the 2008 ADA Amendments Act, and for the passage of the Affordable Care Act, among many other historic pieces of legislation that provide rights for people with disabilities. And the hardest thing I do in my job, people often ask me, what's the hardest thing you do? The hardest thing I do is to receive calls from people every day. Not a day goes by that I don't receive a call from someone who says, they're experiencing a problem, an issue, something's going wrong, and they want to know, why can't the president's special assistant to the president's disability policy advisor help or fix this particular problem? And sometimes I can, sometimes I can't. A lot of ethical rules go along with what we can and cannot do, or can and cannot say. And I know, intellectually, the stuff we're doing is helping people on the ground every day. You really do understand that. But I think we get caught up a lot of times in what we're doing and working and putting together events and, pushing through new policies that we don't get a chance to hear the stories like Teresa and Tina. And it's good for me. And it brings me back to one of the president's campaign slogans. It really gets me fired up to go back to work. And it's really why we do what we do. And it's why the president gets up every day to make sure that the American people are safe and that we're providing a better life and a better opportunity for people like Quentin and Teresa and Tina. It's why Secretary Sebelius is here today. It's why she's worked so hard for passage and now implementation of the Affordable Care Act. It's why Melody has put together a great team. It's why Jeff and I work the hours we do and work with all of you all to make sure that people with disabilities are having a better life. So I don't know about you all, but I'm excited. Thank you all for coming today for another event celebrating the 20th anniversary of the ADA. We look forward to more events, continuing to work with you all. And thank you to Teresa, to Quentin, and to Tina. Thank you very much.